Good morning, everyone. I hope that you can hear me and see me. This is a bit like sitting in a television studio and assuming there is a world out there, but I really appreciate that you have taken the time to join Centre for Aging Better and so many more people this morning. So, welcome. Some of you won't know me. I'm Carol Easton. I'm the Chief Executive at Aging Better. A great privilege, I promise you. So today I'm going to be joined by some great speakers. Pam Smith, who's the Chief Executive of Newcastle City Council, David Finch, Assistant Director of the Healthy Lives team at the Health Foundation, and my colleague Aideen Young, who is Evidence Manager at the Centre for Aging Better. So even though we're all online, there's still housekeeping to be done. It's not fire escapes, but to remind you that we are streaming this session on the Aging Better YouTube channel, and the webinar will be available to view on demand immediately we've finished. We definitely want you to think and ask questions, so please put them in the Q&A box, and we will be trying to get through every question today, but we may not be able to do that. We've only got an hour and lots to talk about. So there'll be a summary. We're thinking of doing a summary blog to answer some of the other questions that we may not get round to answering today. You know, I hope already that today's webinar, we're going to explore the themes from our flagship report, The State of Aging 2022. And there is a link to the publication in the resources tab on your screen. But really, to bring it to life for you, I have a huge pleasure to introduce Aideen Young, who's really largely responsible for the content, the quality, and the importance of this report. So, Aideen, over to you.
Thank you very much, Carol. Let me just get my slides up. Oops, oh dear. Can you see that? Is that working?
Yes.
Good. That's great. I opened it in the wrong place, so I sort of gave some of the story away there. But thank you, Carol, and good morning, everyone. And yes, I'm delighted this day has come. It's been a big job. Just to get stuck in, there's lots to get through. When we talk about our aging population, we are referring to two things. We could be referring to two things. The first, that we're living longer, that is, that individuals are living longer lives than they used to. And secondly, and the two things are connected, that there are more and a bigger proportion of older people in the population. Now, as regards that first point, that our aging population is the result of and synonymous with longer lives, as you can see here, life expectancy did indeed has been gradually increasing. And there was quite a large increase up to about the 2011-13 period, after which it started to level off, as you can see there. And then between the 2017-19 and 2018-20 periods, we actually had a decrease in average life expectancy of about 5 months for women, for men, and 4 months for women. Now, that might not be surprising in view of the pandemic that we've been through, but of course, we have no way of knowing how long it's going to take for this this downward blip to correct itself. But in any case, even before the pandemic, the trend was for this sort of leveling out of our life expectancy. And it seems as if, for the moment at least, our life expectancy is in stasis. And so on this individual level, at least, our population isn't really aging. But the other way in which a population can be aging is the number and proportion of older people that we have. And this shows the percentage change that we're going to see in each of these age groups, 20 to 34, 35 to 49, 50 to 64, over the 20 years to 2042, which is the purple, and over the 40 years to 2062. And there are about 11 million people currently in each of these age groups. And you can see that over these next 20 and 40 years, there's not going to be much change in these. They stay about the same. But let's see if we can make this work. Look what happens in the younger age groups there, the 0 to 19. We see a very big drop in the proportion of people, in the population of people aged 0 to 19. 10% drop over the 20 years to 2042. And that is the result, as you probably know, of declining birth rates and increasing childlessness. But look at this. Look at the increase that we're seeing in the number of older people, and most striking, in the number of the oldest people. There are currently 3 million people aged 80 and over in the population. In 20 years' time, there'll be 5 million. In 40 years' time, that number will have doubled. Now, the reason that the number of older people in the population is increasing so much is as a result of our historical birth rates, particularly that big baby boom across the 1960s. And it's also the result of the fact that death is now something that happens mainly in older ages and not across the life course. Now, we always say, and it is obviously true, that this is a great thing, a great sign of ours of success, that death has been pushed to older ages, and consequently that we have a huge number of older people. Now, at the Centre for Aging Better, we want to ensure that everyone has a good later life, that they have everything they need to enjoy their later lives, that they have good enough health, a warm, safe home, adequate finances, and so forth. But this huge number of older people that is coming presents some challenges as to how we will achieve that, and has massive implications if we fail to act to address this changing age structure. Now, one of the most important things for a good later life is to have good health. What we want to do is to live in good health to as close to the end as possible. We are a very, very long way off this goal. This shows disability-free life expectancy, which is a self-rated assessment of how health conditions and illnesses reduce your ability to carry out your normal day-to-day activities. The purple bit is the number of years in good health, and the blue bit is years spent with some sort of limiting condition, and to get added together, those give life expectancy. And you can see that we are living a very large part of our lives with some sort of limiting, persistent illness or condition. Women on average can expect to live to just 61 in England in good health, and another 22 years with some sort of limiting condition. And not only that, but things just keep getting worse, as you can see here, which is really quite extraordinary, and particularly striking for women. Disability-free life expectancy of women has actually decreased by 4 years in the last 10. Now, it was average disability-free life expectancy in England, but of course there is no such thing as an average man or woman in England taken as a whole. Rather, we see huge differences across the country by levels of wealth and by geography. So I hope you can see this, because on the left, what we have 2 bars for men, 2 for women on the right, and on the far left is the men in the least deprived areas of the country, and then most compared to most deprived areas. And so what you can see is that the poorest live the shortest lives, and a much bigger proportion, you see the size of that blue bit at the top, a much bigger proportion of their shorter lives with the limiting condition. Men in the most deprived areas live 9 years fewer years, have 9 years fewer of life than the men in the richest areas, but 7 years more in poor health. And the situation is on the far, far right. The situation for the poorest women is particularly dire. Only 51 years in good health, and another 28 with some sort of limiting condition. And we see the same socioeconomic trend for many other measures of health, whether we look at people's general health, the number of health conditions they have, which you have here is we've got no health conditions, 2 or more health conditions, or a limiting long-term condition, according to whether people are in the lowest or the highest wealth quintile. And you can see this same socioeconomic pattern, regardless of what we're looking at. Now, financial security is also vitally important if we're to enjoy our good later lives, a very important topic at the moment in particular. And we have reported, and in this state of aging, on the big increase in the number of people of pension age who are living in relative poverty over the year to 2019-20. The current cost of living crisis certainly does not bode well in this regard. One of the principal factors associated with our financial security in our later lives is has been our earnings across the life course and our pensions, which are all shaped by our employment history. So let's take a look at what is happening in the labour market. This chart shows that there has been a long and steady upward trend in the employment rate of people aged 50 to 64. In fact, in the last quarter of 2019, just before the pandemic, there were 9.3 million people aged 50 to 64 in work, the highest number ever. And in fact, they comprised a quarter of the total workforce. But since then, there has been a 2 percentage point drop in the employment rate of this group. That is 112,000 fewer people aged 50 to 69 in work than there were pre-pandemic. On this side, I have economic inactivity, which is distinct from unemployment. It refers to people who are neither unemployed nor looking for work. And the distinction is important because if people are economically inactive, they are not engaged with Job Centre Plus, and most of them also are not receiving any sort of benefits. So they are out of the system. They're kind of lost to the system, and that's an issue if they are to be helped back into work. So economic inactivity among people aged 50 to 64, like unemployment rates in this group, have been steadily falling over time, but have also increased sharply since the pandemic. And there are currently 228,000 more people aged 50 to 64 who are economically inactive than before the pandemic. And as you can see here, that bar in red shows that the bulk of those people are men aged 50 to 64. Importantly, it is not just the better off who have decided to retire and stop working during this period. Some recent data from the ONS shows that there are also the people with fewer qualifications in lower paid roles have also been leaving the labour force in much larger numbers than pre-pandemic. It is most unlikely that these people are financially secure enough to support themselves to the ends of their lives without working. And we know that older people, once unemployed, take much longer to get back into the workforce than younger people. So it is very urgent indeed that older people who have fallen out of the workforce and have sort of disappeared from the system are supported to get back into work if they need to. Otherwise, we really are storing up very significant problems for the future. Now, the other big area of work for Aging Better, as you may know, is the state of our homes. And if we have not had not fully grasped the importance of our homes before the pandemic, then we surely do now. We have seen really close up the impact of overcrowding, which allowed greater virus transmission. We've seen the impact of a lack of space, indoor and outdoor space, and we came to understand how poor quality homes could cause and exacerbate health conditions that led to worse outcomes from COVID. So what do we know about our homes? We know that there are currently 4 million non-decent homes in England. That is to say, they fail to meet the basic decency criteria set up by the government. And there's 4 of them, and they're listed down below that chart. More than a quarter of all non-decent homes are in the private sector, and as shown in the chart, a slightly different stat is that almost a quarter of all homes in the private sector are non-decent. But that chart also shows that the chart also shows that almost 1 in 5 of owner-occupied homes are also non-decent, which is an important statistic. And we know that half of all non-decent homes are headed by someone aged 55 or older. And of privately rented homes headed by someone 55 or older, almost a third are non-decent. And that's another interesting statistic as well. Now, note that the English Housing Survey, which we've used here, only records the age of the head of the household. So there will be many more people. If there's a head of the household age 55 or older, then there's a great likelihood there'll be another person at least age 55 or older in the house. So the point is that there are many more older people living in non-decent homes than the English Housing Survey actually shows. And this chart shows these 4 ways in which a home can be non-decent. It shows the prevalence of these by the age of the head of the household among privately rented homes. And so you can see that category 1 hazards, things that are a hazard that are to the health of the person in the home, that could be mold or damp or electrical hazards, anything that might cause falls, asbestos, things like that. Category 1 hazards are the most common way in which privately rented homes are non-decent. And you can see that the prevalence of this increases with age. Almost a quarter of privately rented homes headed by someone aged 75 or older have at least one category 1 hazard. So it is very clear that the condition of privately rented homes is a very big issue, and that it's very serious. It's very serious for older people, and it puts their health at risk. But we do know that most people in mid and later life do own their own homes. Notwithstanding the fact that which we've just seen, that owner-occupied homes can also be non-decent. But so how big of a deal, though, is it, if most people own their own homes, how big of a deal is it that these privately rented homes are non-decent? Well, it's quite a big deal, actually, because the number of homes privately rented by someone aged 55 or over has been steadily increasing. 366,000 back in 2003-04, up to 867,000 today, an increase of 92,000, actually 92,000 more homes privately rented by someone aged 55 or over in the last year alone. So although owner occupation is the most common form of tenure for people in mid to later life, it's clear that younger people are finding it increasingly harder to get on the housing ladder, and we've all heard about this. And that means that future generations of older people will be less and less likely to be home owners too. Now, this is a big deal for 2 reasons. First, because of the financial pressure that it puts people under. We know that 1/3 of privately rented homes headed by someone 55 or older are in poverty. And it's also a big deal. This pattern, this trend we see here is also a big deal because of the issues of non-decency that put the health of these people at risk. I would like to close this very quick overview of our state of aging by pointing out that our aging population will not always look the same as it does today. And that brings us back full circle to considerations of our population structure. This chart, I hope you can see it there. You've got, starting at the bottom, it shows age groups. So the bottom 0 to 9 years, and at the very top 80 years and over. And the pink bit, I hope you can see that, is white British. And so what you can see here, we're looking at the ethnic makeup of each age group. The ethnic makeup of each age group. And so you can see that the majority of every one of these age groups here, from the 0 to 9 to the 80 and over, is white British. And you can see too that it's the younger age groups where you find most people from an ethnic minority background. In fact, in those age groups younger than 50, between a quarter and a third of people are from an ethnic minority background. But there are very few in those older age groups. But of course, these people are aging. They are making their way up the population pyramid. And so in 30 years' time, 1/3 of our 60 to 69-year-old age group will be people from ethnic minority backgrounds. Now, why is this important? Why do I point this out? It's important because people from ethnic minority backgrounds face huge issues of inequality. They are underrepresented in the richest groups and overrepresented in the poorest. And as they get older, the inequalities that they face get magnified and exacerbated. And so they will carry these into later life, and they just get larger and larger. For example, we know we know that health inequalities get bigger and bigger as people get older. So if we want everyone to enjoy a good later life, we must deal with the conditions that give rise to inequality earlier in the life course. Otherwise, the inequalities that we already see in our older population, and which I hope is the main takeaway of this state of aging, we already have terrible inequality in our older population. But as these people from ethnic minority backgrounds get older and carry the inequalities that they face into older age, the inequality in our older population is just going to get worse, and that will be a very serious situation. And so I will close with that. Thank you very much.
Aideen, thank you so very much for a whistle-stop tour of a very comprehensive report, which people can read at their leisure online. And I'm sure there's so much more in there. It wasn't possible to cover it in the very few minutes that we gave you. So really appreciate that. So it's my pleasure now to introduce David Finch, who is, as I said, Assistant Director, Healthy Lives team at the Health Foundation. All our presenters have incredibly much more interesting biographies than I have time to share with you today. So again, really encourage you to go and do a bit of Googling and find out much more detail about their backgrounds. But meanwhile, David, I hope you can hear me and everything is working, and really interested to hear your response to this research.
I see, and thank you for the presentation, and of course the report that underlies it. I mean, there's some really striking analysis in there, and as you said, there's a lot more detail in there to kind of dig into. But I think from our perspective, and it's the thing that was being started to be talked about, was really the kind of wide health inequalities, which I mean, I think they've been gone through in detail already. But I think from our perspective, they're very wide. There's a kind of 20-year gap in the healthy life expectancy for women born in the least and most deprived areas. And before the pandemic, those trends were worsening. And I think the pandemic has only served to kind of highlight that even further. And as has already been shown, those inequalities have worsened through the pandemic. But I think what's really important as well is this emphasis on those wider conditions that people live in that are really important for influencing their health and are the key drivers of people's health outcomes. So they're much greater importance for people's health than the NHS and social care system are alone. And as also came through strongly is that focus on employment and housing. I mean, I think those are two areas that we are also very interested in. As I think, again, has already been discussed, the pandemic again highlighted that there's the point around housing, which it's not just, I mean, overcrowding itself had some direct consequences for kind of increased exposure to COVID. But this point of how it really brought out how the quality of the homes that people are living in really mattered because of the amount of time that people were spending there. And I think the other kind of thing you've highlighted there coming out through the pandemic is employment, which is something that I think particularly in the early stages of the pandemic was something we're very concerned about from the perspective of having a large cohort of people potentially unemployed as the pandemic kind of unfolded. But actually the significant support the government put in through things like the furlough scheme has helped to prevent that kind of big rise in unemployment. But it is this rise in inactivity that is very apparent. It's focused among older people, and particularly with health a key reason, is something that we are focused on at the moment and think is something important to be considering. And I think it actually goes back to a kind of pre-pandemic trend where we did see that rise there was that kind of growing increase in employment amongst older workers, which is important to help also boost living standards among them. But a kind of a key reason for people not in work still was still their health, and that's why we think that's a kind of a key focus going forwards if we're going to not just address some of the trends that have come out of the pandemic, but help to boost the living standards of people who were struggling to find work even before the pandemic came through. I think as well, as from my perspective, it's seeing those trends and seeing the things that have been happening, and then as we enter yet another crisis with the cost of living crisis, there's some very all too familiar fault lines appearing, and I think that the danger from our perspective is that this time there is actually a lack of government action. So whereas we saw very significant support going through the pandemic, that's not happening as the cost of living crisis starts to unfold. The OBR projected that a 2% real term drop in incomes for people this year, and a further analysis from people like the Resolution Foundation have shown that actually the groups with the greatest drops in real term income are going to be the poorest people. So that lack of action this time around is really leaving the most vulnerable and more exposed. I think my final kind of reflection on that specific, before getting into perhaps some more optimistic comments, is really about this kind of the problem of what this might mean for older people in future as well. So that kind of perhaps it's almost forgotten because of the pandemic, but before, in the decade before the pandemic, there was the stalling of life expectancy. An analysis that we were doing at the time really highlighted that there was some of this was around worsening health of people, not at the very oldest ages, some at younger ages, but also people into their kind of 50s and 60s. And there is a concern that if there is that poorer health amongst the population, that as they age, if we take something like high levels of obesity amongst younger ages now, by the time those people are moving into their 50s and 60s, there's a real risk that actually the health picture looks worse in future. And I think just can only emphasise that need for some more upstream action to be taken and investing in the longer term. I think just to try and insert some optimism into that, because I think that's probably quite a negative outlook for the future. There is much that can be done about this. History does show that concerted policy action can make a difference. One area I think important there is the role that local authorities and local areas can play. There's obviously a trend towards giving greater power to local areas, and we think that's important because of the control and the influence that local authorities and city mayors can have on the factors that influence health within their local areas, and also that inequalities in health are wide even within those local areas. So although people often talk about the kind of difference between Glasgow and Kensington, for life expectancy, there's also quite wide inequalities even within kind of city regions as well. So that's quite important to recognise those, which is something that is kind of slightly missing at the moment in the levelling up agenda around health. And I think that some of those key factors through which you can have a difference at a local area come through employment and skills, planning around housing, and also kind of transport infrastructure and air pollution. And so there are some very practical things that can be done, even within what is a very tight kind of, I suppose, fiscal environment for local areas, in thinking about how they're doing the actions they're taking, where if you take kind of economic development plans or action around climate change, and thinking about how those things fit together, and also with health, to make sure you've got some coherent design that is supporting kind of future outcomes. And then, but I think there's also a real need for a kind of concerted cross-government plan on health inequalities. Obviously, there is a target in the Levelling Up white paper around reducing health inequalities and increasing healthy life expectancy by 5 years, by around 2035. I mean, we think that's a really ambitious target, given there has been little to no improvement, and if not, in fact, worsening for women on that metric. So if we took current trends, it will take in the region of around 200 years to reach that target, rather than the kind of 13 the government are allowing themselves. So, I mean, I think it just really highlights the ambition there, but also the need for some concerted and clear action. We think that's partly about having very strong political buy-in and some real clear mechanisms to ensure change across government. So this is joining up across the centre of government and making sure that different departments recognise the role that they can play in helping to support people's health into the future. And also making sure they're kept in check on some of those ambitions, so things like reporting to Parliament. But I think there is the OHID Health Disparities White Paper due, I think, before the summer recess. So there is an opportunity there to show that the policy ambition is matching the ambition on targets. But I think there's a lot of work to do, from comparing what's in the Levelling Up white paper to what you would need in that kind of more comprehensive white paper to tackle health inequalities. One of those is a much clearer and more specific framework of measures to show how you would go around improving health and the determinants of health. Another one of those is going much far beyond the last green paper, which focused much more on acute need, things like tackling obesity and smoking, but it really needs to get into tackling the conditions in which people live. So that's support for employment, support for living standards, and eradicating food insecurity. And lastly, coming back to housing again, really an opportunity to bring some renewed focus on tackling standards and insecurity in the private rented sector. Thank you.
David, thank you so much for stepping in and giving your insights and really drawing that more broadly into what both local and central government could begin to do to really move this agenda on. So really appreciate that. So my pleasure now. I'm not sure whether we're going to be able to see Pam or not, but to introduce Pam, who is Chief Exec of Newcastle City Council. Are you there, Pam?
Hello, yes, can you hear me?
I can hear you, but I can't see you, which maybe means the audience can't see you either, unfortunately. So do go ahead.
Thank you. Thank you so much. And first of all, what a brilliant report, I have to say. And in terms of putting across older people and the health inequalities that exist, and all those inequalities that we need to tackle. The report clearly shows that, and in Newcastle, we have a 10-year age difference between the most deprived and the least deprived areas in Newcastle. And it's a real drive for us to tackle these health inequalities. And what we've done in Newcastle is we've come together as a collaborative partnership, as a whole system, to look at this issue, very much learning from the work that Ageing Better are doing, very much learning from what's been done around age-friendly neighbourhoods. So we've come together in Newcastle, and that includes the NHS, the council, universities, industry and communities. And we've taken a system-wide approach to driving innovation. And what's behind that is we want to support people to live long and healthy lives. So we want them to live their best older life, if I can put it in that way. And some of the things that David has said about, it's about local government and central government and business and the voluntary sector. It's about us all taking that systems approach and applying it to place to make sure that we're innovating. So I'm going to be a little bit upbeat, if you'll allow me to be. I'm going to misquote Tom Peters, a famous economist, who said, the future of the economy isn't India or China. In his view, it was women. I'm going to say it's our ageing population. Because if we innovate for our ageing population, then we innovate for everybody. And it's not just the big innovations that we're looking at, it's some of the smaller things. So, for example, our home care group managed to avoid 1,670 admissions to hospital. And what that means is it's good for the hospital, but it's good for individuals. It means that we're promoting healthier lives by intervening earlier. So one of the things that we're trying to do is to pivot some of our funding, which is really difficult, really tricky. Everybody needs more resources in this area, but what we're trying to do is fund the prevention agenda And we're doing that by working together and applying ourselves to some of the innovation. So I'll give you an example. We've got the National Innovation for Ageing, National Innovation Centre for Ageing in Newcastle, and we've also got the National Innovation Centre for Data. And whilst we have a richness of data in this area, we want to make sure we're applying it in the right way. So we're coming together to look at all our data on our older population to try and understand what are the interventions that we can take earlier that are going to have an impact. So we're looking at this from a longevity economy point of view, and making sure that older people are involved in that product development. So we're looking at the ageing population as an opportunity to work together to try and be an exemplar for resolving some of these issues and taking a step forward, recognising that there are inherent inequalities and these start early on, but looking at using our older population as a test bed for lots of products and trying to make sure that our older population is involved in creating the new neighbourhoods and places where they feel that they can age in place comfortably and make a contribution, continuing contribution to society. We're also working with our academic partners in Newcastle, so we've established our own academic health science partnership, and we're the only one in the country to have a local authority as a partner. And again, this means that we are trying to look at evidence-based practice, but we're rooting it in the lives that people are living. So we're trying to make sure that we're developing through our partnerships actions that matter to people and products that are going to enable them to live independent, more independent lives. We really feel strongly that on health, there's no health without social care, and we're trying to reimagine the system, so pivoting the system so it's a social model that supports a health model, so taking those interventions earlier on that are needed. Your other speakers have David talked about housing, making sure that we've got the right housing that people can grow with. So we are making a major investment, £500 million in our campus for ageing and vitality, which is a 29-acre site. We want to make sure that it's a global exemplar for ageing in place, and we've got the opportunity to be a real test bed there. On the employment side of things, I think taking a more personalised approach, we've seen the reduction as detailed in your report of the numbers of older people who've dropped out of the marketplace since COVID. And what we're trying to do is personalise that support and enable some of our older workers to switch jobs, because that's a part of it as well. What jobs are people able to do? So we're very much trying to take a more personalised approach around that. In terms of the housing issues, the tenure is clearly a big issue, and as our population is aging, we're seeing more and more people renting. So the things highlighted in the report around decent homes are really important to us. So we want to try and look at more mixed tenure and to try and enable that so we can support older people in homes that are healthy and that can enable them to thrive. I'm not going to go into all the areas. I wanted to give you a flavour of the kinds of things we're doing in Newcastle, but overall what we're trying to do is have a longevity dividend, if I can put it in that way, rather than seeing this as a kind of in the negative, which there are clearly some serious issues that we need to tackle, but overall setting our goal out to say, we are going to approach longevity, and we are approaching longevity in Newcastle as an opportunity to involve our whole community in reimagining and redesigning the future. And as David alluded to, climate change, digital, these are the big issues of the day, and we are involving our older people in conversations around how to tackle these issues, but how to make them relevant to improving their lives. And we really want to make sure that we are creating places that are intergenerational, because I think the other challenge for us is that we don't just see this down one lens. We look at longevity across the age, because things that people do earlier on in their life are significantly going to impact on how they can live their best later life. So we're trying to take a holistic approach, but my message really is that we've got to come together, public sector, private sector, across the board, so that we can innovate for a better older age and make sure that as our population gets older and maybe wiser, that we're up to the challenge to make sure that innovation and the way we organise ourselves as a society is age friendly but enables us to age better. Thank you.
Pam, thank you so very much. I really, yes, one of my takeaways will be the positiveness and how, like you say, because it's such a good challenge to the underlying ageism that is one of the impeders for all the work that you and others are trying to do. So really appreciate that. I'm going to ask my colleague now to just show you, while we give you a little bit more time to think of questions, though I can see some have been coming up already, just a short video to give you a sense of some of the people we've spoken to during the period of the research.
Everything is going up. Heating is going up, food is going up, and pension credit is not going up very much. So people are left quite desperate, trying to cope with all the bills and shopping, etc., for necessary items. It's not just food, you need other things too to live.
We had an MP quite locally, as you might have heard, who said he felt sorry for young MPs who had to live at 83,000 a year, Those are people who just can't imagine that they haven't got enough money to get a television license.
I think that the only way to do anything about this is some fundamental rethinks of our entitlement as citizens to a reasonable amount of food, to warmth, to light and to heat, which we can well afford in view of the huge disparity in what people are earning and what people have.
There's always something else that's more urgent. Always. Yeah. Never mind about the old people, No, I think there's a lot of listening and nodding of the head and yes, we understand and we'll do something, but when you actually look at statistics and, as you say, that as the pension goes up, there's not a lot of change, is there?
It's absolutely of vital importance to have a commissioner for the elderly, because when you're older, your energy dwindles. You haven't got the energy to fight the system. You haven't got the energy to fight unscrupulous landlords. You haven't got the energy to fight councils.
A commissioner would highlight the good that old people can do, and would also champion the cause of why old people, we're a part of society. We're not different. We're not tagged on at the end. We all get old.
Thank you. Right, I hope We're back to the panel now, and a chance to pick up some questions. I'm already can see we do have some questions in the chat box, and because we haven't got too much time, I think I'll head straight there. Aideen, one for you. We've been asked, first of all, thanked for your excellent presentation. Do you have views on what your findings mean for the state pension age review, and the kind of link between limiting illness and disability, I beg your pardon, and people's ability or not, as the case may be, to work?
Yeah, it's very difficult. I mean, you saw the data with the poorest woman being able to live 50 years to the age of 50 before the advent of some in good health, before the advent of some limiting long-term condition. The idea then that you would raise that they would not be able to collect their state pension until the age of 67, which would be 17 years, is really rather troubling. And David has alluded to that about the issues of health at work being one of the most, an important thing to consider. So I mean, I think there are huge challenges around the state pension age, but I think we really do need to be aware of the huge inequality, and that some people will really struggle to work until their late 60s. But that then is part of the sort of consideration about employers we need to have employers and workplaces that are able to accommodate and be flexible enough for people with long-term conditions to allow them to work. I mean, we did some work on this. I mean, people need only very minor adjustments to enable them to continue to work. The only very minor, small things will make all the difference. So that's a really important thing. I mean, we have to address inequalities. We need people to live longer and healthier lives. We need workplaces where people can be supported to work in spite of their health conditions. But yes, sweeping universal changes in state pension age are definitely challenging.
Thank you, Aideen. Pam, maybe one for you. Growth that you talked about, employment and work, and growth of economic inactive over 50s. If they were young people, we'd be calling them NEETs, of course, wouldn't we? Masks a lot of issues affecting older workers, and ageism being one of them. Do you think there is a perception that older workers may not be skilled enough or equipped enough for demanding jobs? And what do you think, or what might you be doing about that?
Yeah, I think there is a perception that older workers aren't as agile as younger workers, but I think it's about, as has been said by Aideen, it's about job design. We have a workforce shortage in many areas of the economy. If the economy is going to thrive, then we need to make sure that we're making reasonable adjustments. But we also need to work with our SMEs, as well as our big corporations, on how we can ensure people are fit for work. And I think it is that personalisation. What can we do to support older people in work? Because it has many, many benefits. Years ago, a colleague in public health said to me, Pam, the best thing you can do for people's health is get them a job. And I think that shouldn't matter how old that person is. And as long as we can make those adjustments and personalise it, then I think we should be in a position for older people to make that contribution to meaningful employment and employment that matters.
Great. And would you agree then that there is a kind of general perception that somehow, post 60 or 65, people are too old to work?
I think that there may still be some of that prejudice out there, and I think it's a matter of more education for employers, and maybe some more incentives for employers to have a workforce that is reflective of the whole community. and that you do have that diversity in terms of age. So maybe we should be asking questions of employers. What are they doing to attract older workers? So maybe that's something that we should be thinking about nationally.
Okay. And also looking inward too, isn't it? I mean, I think for me, having one of the pernicious aspects of any form of prejudice or stereotypes is how they're internalized by people themselves. So older people themselves lacking confidence and not feeling able to put themselves forward unless they get the correct support and encouragement to do so. David, question for you, I think. You talked really crucially about some of the current activities going on or that could go on even more in local and central government. What do you think is the biggest barrier at the moment to change? And what do you think is the biggest risk we need to prepare head on?
So I think one of the big challenges is moving beyond. I suppose we are hearing more, particularly from kind of, I suppose, people like Secretary of State for Health. They're talking more about health inequalities and the need for action there. And obviously, we have this ambition in the Levelling Up White Paper. But I suppose the challenge, which is often quite a challenge, is moving away from that kind of rhetoric and recognition of an issue into some actual action and having that sustained action and effort over the longer term. Because I think these aren't short-term fixes where small measures will make enough of a difference. So I think there is it's really moving into that kind of concrete, concerted action phase. And I think also I think a thing that tends to happen as well is people tend to associate health with the NHS or social care. And so although health tends to be one of the top priorities of the public, although I think at the moment the cost of living has sort of has taken that for a short period of time, or perhaps for the next year, it often that ends up being a commitment to spending more on the NHS and doing more around the NHS. And it doesn't translate into a commitment into that longer term preventative action. And I think that's that's possibly challenging in the kind of fiscal environment where you don't have, so Pam was talking about this, that need to have the need to address things upstream, but that means finding somehow the ability to tackle both the acute need and that longer term, that upstream intervention at the same time. And I think that's the kind of, those are some of the real big challenges that we're facing, is really getting into that proper implementation phase.
Yeah. Really, that long term, as you say, in commitment for the long term is always something, isn't it? And that joined up across government as well, that you talked about earlier, seem to be challenges we've yet to overcome. Aideen, was there anything that surprised you in this report? Did anything jump out or that you didn't expect?
I remember being surprised at the big increase in the number of private renters. That was a sort of, didn't quite expect that. I suppose we knew about the fact that people had fallen out of work. We've seen a big increase in the number of people who are inactive. So that was, that's a big issue in this. Yes, I think the housing data turned out to be very, really quite interesting, I thought. And the increase in private renting, I thought was quite important.
Yes, something that surprised me too. So I've got one final question for all of you briefly, and then I will deal with the question about the Older People's Committee. There's also a question about Older People's Commissioner, which I will come on to at the end. So finally, maybe Pam first, what do you've clearly got a good example of initiatives and strategies across UK, other countries where ageism is being successfully tackled. Do you have any, you're obviously by your work doing that and by your whole approach to the work that you're doing for older people, you're also tackling ageism. I suppose the question for Pam is, was there some other place that inspired you, or do you think there's somewhere else we can look at where we can learn about how to deal with the stigma and taboo? That was a question. So Pam, what do you think?
I think, Greater Manchester is a good example of tackling ageism. There's some great work going on in the UK, but and there's some great work going on in in Japan, where they've got a much faster aging population than we have here. But I think it's more than looking at examples. I think it's putting older people at the heart of policy and at the heart of innovation and at the heart of communities. And I think if we really truly engage our older population in that, then we're going to create the places where they want to be and they want to live. But I do think one of the jobs around an older people's commissioner would be a 30-year plan, because I think we need to reimagine the future and then put that plan in place so it becomes a reality. So for me, putting our residents and putting our residents of all ages, because we need to be including our 30 and 40-year-olds, because they're our older people, of the future. So I think it's about that, because different models will work in different places. And given that the pressures on the cost of living, on the climate, on the need to be innovative and really embrace digital, I think we've got to do all that and create those places where older people feel they belong, they want to live, and they can have a really good life, given all the challenges of increasing prices and the increasing pressures as you get older. I think that's kind of the key for me.
Okay. Thank you.
Going forward.
Thank you, Pam. David, do you want any add to that? Any final comments? Did you hear me, David?
Sorry, I think my internet connection dropped out just for a second. Sorry. So
just any final comments or comments on where you think they tackle ageism well?
I try to think of a specific perspective had it. I mean, I think the thing that Pam was mentioning about with employers earlier, I do think sometimes it's about going out and of explaining the opportunities available to them. It's something that's happened with around flexible working more, which is usually it kind of focused on mums at younger ages, but often employers just don't think or realise that there is that. Or they can not realise there's that opportunity there or that resource there, which with some slight adaptations to what they would normally do, means that they can find more quite well-resourced and able workforce. So I think there's something about just kind of getting past that initial barrier where perhaps people just are for historic reasons perhaps just not thinking about that group of people in those opportunities.
Okay, thank you so much. I'm sorry, my voice is going a bit croaky now, so apologies. We have run out of time, sadly, and there are many more questions, but we will draw this to a close as published. So I would like to say thank you to Pam, to David, and of course to Aideen and the rest of the team involved at Aging Better in pulling State of Aging together. The words inequalities are probably, if there was one word that jumps out of it, it's going to be that, isn't it? But also I really like the optimism that both David and Pam bring in terms of, what we can actually do about it and how everyone has a role to play in that. We are, to answer one or two questions, we are at Aging Better beginning to campaign for the creation of a commissioner for older people. Someone's put their email address in the question box, so I will ask my colleague to capture that, and we'll pick that up after the meeting to discuss how we might be able to work together or talk about that together. At least we think it's really important, as has been said already, that there is a champion, but also not just in a vacuum, that there needs to be a plan, a strategy for the aging population, but particularly about how we're going to address inequalities that, in my view, are totally unacceptable in the 21st century in a rich, developed country. So really appreciate everyone's commitment to that. Don't forget to put your thoughts about this webinar. There's a link apparently going to be put in the chat for you. And obviously do join other Aging Better events. Really appreciate your time today, and time to say goodbye and have a good rest of day.